Introduction to medical cannabis. Cannabis was used in ancient Egypt in the 1820s as a medicine for pain, epilepsy, eye conditions, and anxiety. Ancient Romans and Greeks used it in food, wine, and as a surgical painkiller. On November 1, 2018, UK law reclassified medical cannabis as a Schedule II controlled drug. This means cannabis can now be prescribed like other controlled medicines such as diamorphine and fentanyl. GMC-registered specialist physicians in the UK can prescribe medical cannabis to their patients. Cannabis has three different species: ruderalis, sativa, and Indica. Indica strains produce a physically relaxing or sedating effect, while sativa produces a creative or cerebral stimulating effect. Most cannabis medicines are hybrids between the two strains. The female unfertilized flower head, sinsemilla, contains the highest concentration of cannabinoids and is grown in controlled greenhouses. The flower head can be used directly as medicine. Roundup is called kief, or sometimes compressed into a block called hashish. The flower head can be smoked in a joint or vaped in a vaporizing unit. For medicine, it's mainly used as cannabis oil or capsules. Hemp and marijuana are the same plant. Industrial hemp, also known as cannabis sativa, has been grown commercially and used mainly for industrial products such as clothes, paper, textiles, and plastics. The seeds are very nutritious and are used in creams, moisturizing agents, cooking, and oil-based paints. The most common phytocannabinoid in the cannabis plant is tetrahydrocannabinol, THC. THC is the compound that creates the high associated with recreational use. THC has many medicinal properties such as pain relief, anti-inflammatory, muscle relaxant, anti-nausea, and antioxidant effects. The second most common cannabinoid in the plant and the most prevalent non-psychoactive one is called cannabidiol, CBD. CBD has anti-anxiety and anti-convulsant properties. The 99.9% pure CBD product, Epidiolex, is licensed in the US to treat child-resistant epilepsies. CBD can counteract the psychoactive effects of THC, making both viable together. Most manufacturers produce several CBD and THC varieties with similar proportions, high in CBD and low in THC, and vice versa. For example, cannabinol is a breakdown product of THC that promotes bone growth after fractures, aids sleep, and stimulates appetite. Terpenes are the compounds that give cannabis plants their smell and have medicinal properties such as limonene. Flavonoids give cannabis and other plants their colors and have some medicinal properties. For example, quercetin is found in red coloration, particularly in tomatoes, and has anti-cancer, antioxidant, and antiviral properties.